Thanks everybody for joining us. I want to begin, as we always do, by acknowledging we're on Treaty 1 territory in the traditional homeland of the Métis. I'm joined by Jay Shaw, Assistant Chief Emergency Management. I'll have a few opening comments and then turn it over to Jay for some more detailed remarks, and then we're both available to answer your questions. I want to begin often, as we do, by just reminding Winnipeggers to stay home if you can. When you're home, support local. We're going into the weekend right now, so if you have the means, I'd encourage everybody order takeout tonight, like our family's going to be doing. If you do have to leave your home for work, for essentials, or to safely engage in outdoor exercise, I just want to encourage everybody continue to wash your hands regularly, wear a mask, and watch your distance. As I stated on Wednesday, currently the rivers are closed and retention ponds are always closed. Retention ponds in particular, they're not safe to be on at any time. We have to utilize the options that are available under the provincial public health orders. Skating isn't one of them right now unless it's on a backyard rink. I'll let Jay fill you in on the details shortly. However, officials from the public service are patrolling retention ponds to educate residents who continue to be found using those retention ponds. One of the reasons we're doing this is if there's, obviously if there's, we want to make sure that we're first and foremost protecting the safety of our residents. But if there's less emergency calls for retention ponds, there are more first responders available for other emergencies. There is a temporary parking motion that is working its way through the committee process. It's at IRPW today. The motion extends the 1 hour free parking on all on-street metered locations in Winnipeg from December 31st to June 30th, 2021. It also directs the public service not to enforce residential parking time restrictions until June 30th as well. The exception to that is the annual snow route parking ban, which is now in effect. Vehicles are not permitted to be parked on snow routes between 2 a.m. and 7 a.m. Snow routes are a top priority for snow clearing to ensure that emergency vehicles can navigate quickly and safely around the city. It's important that vehicles are not parked on snow routes overnight to enable rapid and efficient snow clearing of these critical routes. So I'm asking Winnipeggers, stay home and know your zone. Download the Know Your Zone app right now. You can save your address to the favorites on the app. You can also use our online address lookup tool, our interactive snow route map, or contact 311. So again, stay home and know your zone. With that, I'll turn it over to Jay and be available to answer your questions afterwards. Thanks very much. Merci and miigwech.
Thank you, Mr. Mayor. Good morning. My name is Jay Shaw. I'm the Assistant Chief of Emergency Management. As the Mayor mentioned, we're heading into the season of snow. And while we've been fortunate with warm weather and very little snow, we know that won't last. The annual snow route parking ban is now in effect. We are reminding you that it is time to start moving your vehicles off of snow routes overnight, and to ensure everyone is prepared for when the snow does arrive. Take time now to download the City of Winnipeg's Know Your Zone app. Save your home address to your favorites, and you will receive a push notification directly to your phone, advising you when snowplows are heading your way. It's an easy way to avoid a ticket and a tow this winter season. As we're discussing winter, just in case you missed my earlier warnings, I will once again remind residents to stay off the ice and exercise extreme caution around all Winnipeg waterways. While we have been talking about this consistently over the past few weeks, we are still seeing people using the city's retention ponds as neighborhood skating rinks. The ice on our retention ponds is never safe, no matter the temperature outside or surface, no matter the temperature outside or surface appearance of the ice. Ice conditions on retention ponds can change quickly and without warning, creating an extreme hidden hazard. During the winter, water from the snowmelt or nearby water main breaks drains into the retention ponds. This winter runoff is often mixed with street salts that can cause the ice to melt and thin quickly. The water enters the pond underneath the ice, resulting in a thinning of the ice that can't be seen from the surface. We will once again have some of our city bylaw officers out visiting neighborhood retention ponds this weekend to remind residents of the dangers and to help remove items that have been set up on the ponds. And finally, I would like to thank our city bylaw officers. They have been quick to shift focus and to help ensure that our residents are staying safe. It has been nearly 1 month since we started working with the province to help enforce provincial public health orders. In that time, our bylaw officers have completed 2,424 inspections and handed out 13 tickets and 3 warnings for a total of $36,788. No new tickets or warnings have been handed out since our last update. And finally, I'd like to say that we need everyone to stay home, remember to wash your hands, wear a mask, and please watch your distance. We'll now take your questions.
James from the Winnipeg Sun.
Actually, no questions at all. Have a good day, everyone.
Yeah, you too, James.
Thank you.
Yeah.
Jeff from CTV.
Hi, I wasn't able to participate in the last update, but I'm just wondering if there's still any hope, Mr. Mayor, to redeploy any of these city workers who are off to the province. Are those talks ongoing, or is that just a done deal? Is that over with?
No, I mean, that dialogue is continuing, and, should the province want to engage those temporarily laid off employees, we want to do what we can to accommodate that request. But there's no plans to redeploy at this point that we're aware of from the province.
This might be more of a question for the chair of the committee, but I'll take a crack at it anyway. It looks like the pilot to have people prepay their taxi ride didn't go very well, at least from the driver's standpoint. What do you make of this? Should Winnipeg still look at this?
Yeah, I think that's being debated and discussed today at the committee. So, you know what, I'm glad that there's dialogue and that the feedback, that there's some critical analysis happening in terms of what played out with respect to the changes. So I'm looking forward to hearing what happens at the committee. I think we got to be open about how we achieve the desired outcomes of increased safety for everybody. And so, I'll let the committee do their work and look forward to hearing what their thoughts are after they've concluded their work today.
Joyanne from the Winnipeg Free Press.
Just adding on the redeployment question, I know when you first talked about this, there was a mention that city workers could again be redeployed to Winnipeg Harvest or other non-governmental organizations without even involving the province. Has there been any developments on that?
Not yet. When and if, we'll let you know, Joyanne. You're right to point out earlier this year there was some redeployment to then Winnipeg Harvest, now Manitoba, or Harvest Manitoba, I should say, with the new branding. Right now that hasn't occurred, and when and if it happens there or elsewhere, we'll let you know.
And are there any other layoffs or service reductions coming to deal with the pandemic, in response to the pandemic?
None that I'm aware of. The nearly 600 temporary layoffs were pretty significant, and were as a direct result of the provincial public health orders, which have shut down our facilities, and we're supporting the province by respecting those health orders.
Malika from Global.
Hi, this is for Jay. Just wondering if with those inspections and tickets, you said that none were handed out this week. The ones that were handed out before, can you just clarify, were they on city properties? That was what you were talking about?
No, these were tickets that were handed out based on the collaboration and the program that we're working with the province. So our bylaw, we have 9 bylaw officers that are working with the province of Manitoba. And we are currently doing inspections of businesses that have been ordered closed, and making sure that, and the other area is capacity limits. So we've been doing our routes and working with the province. And so the tickets have been to some individuals and to some businesses. So about 2,400 this month.
Thank you.
Sean from CBC.
Jay, can you tell us, do you have up-to-date stats on how many city employees have tested positive for COVID?
Yep, I have across all city departments as of December 1st, I have 20 active, total positive 117. We have 45 people self-isolating, and that's what I have for numbers.
Among the 20 active, can you break down what departments?
No. COVID is affecting, all levels of government, all departments in the province and the federal government, and as well with us. And so right now we have 20 active, in total 117, and self-isolating 45 individuals. But I don't have that breakdown of each individual department area.
I'll just add to that. I mean, City of Winnipeg staff, these are Winnipeggers and Manitobans, obviously want to wish anybody who's tested positive all the very best in terms of their recovery. But the test positivity rate is alarmingly high. I mean, it's incredible how high it is right now, and so we all need to follow those fundamentals to get that number down, but it shouldn't surprise us when you have a test positivity rate in this province as high as it currently is, that city and municipal staff, as well as presumably provincial staff, would be affected.
Jeff from CTV.
Mr. Mayor, I don't know if you had a chance to read the Premier's, I call it a statement after we were all done with our questions yesterday at his news conference, basically saying to Manitobans, look, I am the Grinch, I'm stealing Christmas from you, but it's for the greater good. And if you don't believe in COVID, you're an idiot. I don't know if you got a chance to see that or think, but I would like your thoughts on that and how you feel.
Well, I think we all need to stick to the fundamentals. And right now, I think all levels of government have a difficult job right now. I'd like the focus to be on Winnipeggers and Manitobans, and we're focused on them and how we do our best to keep them as safe as possible.
Follow-up, if I could, and again, because we're limited in our questions when we do get the Premier, I wanted to ask on this but didn't get the chance. And this is maybe a question for both of you. We're seeing in the States leaders like former presidents are saying, look, give us the vaccine first so we can show people it's safe. Would you be up for or anything like that if, whether it's the Premier or the Mayor to say, look, I'll get it first, show Winnipeggers, the Premier show Manitobans it's safe? Is that something that you think is necessary, or maybe because of the short supply initially, that's not a good idea?
Maybe I'll just start. I mean, I went to Shoppers to get my flu shot, and what I would not be jumping at the chance to do is to somehow be perceived as jumping the queue. So the short answer is no. There's folks that need the vaccine sooner than politicians. So now, can we help support the communication of the importance of getting a vaccine? Absolutely, and you can rest assured I'll be very public, as I'll do right now, in saying listen to the doctors and go get your vaccine when it's available. It's one way in which you can protect yourself and protect the community. But yeah, the thought of me or politicians going first, I think there's others in our community who should be first. So short answer is no. I'm not looking to do that. I'll get in line like everybody else.
Joyanne from the Free Press.
So for the city numbers of staff that have been affected by COVID that you gave, has there been any impact on city services or what the city can provide in terms of, I don't know when all these cases occurred, so have we had enough absences that service has been affected at all for Winnipeggers?
No, Joy, not at this time, but, we have business continuity plans, and we meet through our Emergency Operations Center with our Emergency Management Coordination Committee, and we're constantly monitoring and working with our directors and looking to see what we can do to make sure that we're providing those critical services that Winnipeggers need. So, when we started this, monitoring COVID in early January and started meeting and then, activating in March, we kind of set forward a four-phased approach to be able to take care of people, communicate well, and look at advanced planning and always making sure of protecting our essential services. And I can tell you that that's sort of what our main focus has been, is to make sure that our critical services are there. And I can tell you that we've got a really strong, dedicated group of individuals that, are just working like crazy to make sure that we are looking at advanced planning and making sure that we don't have critical service areas. That's not to say that we won't have any. And no one has a crystal ball, but we are doing our absolute best to make sure that we provide those services, and that if we have failures, we have backup plans and things are sort of good to go. So right now, no major issues, but having COVID affecting us is just like it's affecting the healthcare system and other levels of government. So.
Joanne, one of the things I appreciate is at the City of Winnipeg, we have our Emergency Operations Center was activated earlier this year and hasn't taken a break. Jay obviously leads that team. One of the reasons why we raised the idea federally and provincially and are now operationalizing the testing site for first responders is just recognizing the need for all Winnipeggers' safety to have our first responders protected, because we need them to be as healthy as possible, so they're there to respond to calls when we need them.
And getting back to the retention ponds, I guess, have you ticketed or fined anyone for having skating, either rinks or skating trails set up on them, and how many times has that happened, if so?
So we're not ticketing currently. There is a frozen waterways bylaw, so it is actually illegal to be on the retention ponds. Right now, our method is through education and information, and no one wants to be handing out tickets, but it is an option if needed. That's why we've been strong with our messaging that retention ponds aren't safe at any time. And, I can tell you that over the last couple of weekends and during the week, we've had crews out talking to people, having good communication, and for the most part, people have been, really amazing once they engage with either our bylaw officers or our enforcement crews that are out there. If we had to ticket, I mean, that would be sad, but no tickets at this point, and I really hope we don't have to.
Malika from Global.
Yeah, I was just wondering about rapid testing. When it gets to the point where we're extra testing, has there been any talks with transit drivers about them wanting to get those tests out for them? I know there's a pilot project currently, the province with teachers, and there was an ask from transit that they would want to because they're frontline workers. Has there been any talks with the city and transit?
Yeah, I haven't heard any asks from transit at this point. Sorry, I cut you off there, but that hasn't come to the as an ask, but things change day to day, week to week. If that's something that needs a look at, we'll take a look at it. But right now, we haven't heard any ask around that.
Also keep in mind, I mean, that may be a question for the health minister in terms of how they want to deploy testing in the province.
Sean from CBC.
Jay, when there are test positives for COVID among city staff, how does the information flow out to the rest of that department? So, if you get a transit driver and he tests positive, do you tell the whole staff, or do you send a message to the union? What do you do?
Yeah, so the basics of it is it's treated through occupational health and safety and with our HR departments. And like any other medical issue, we do our absolute best to protect the privacy of our employees. So only the most limited amount of people would be informed unless there's a causation or an effect. But through our occupational health and safety branch, if you broke your leg, we wouldn't go around and tell everyone that somebody broke their leg. So it's kind of the same thing. Our employees are our number one asset, and we're doing our best to protect their privacy and their health and make sure that they have a safe workplace to be at. And we're doing that through our occupational health and safety branch, which are doing just a really amazing job. So that's the basics. So we've tried to be able to maintain a strong communication with all of our employees around this. We've got a good internal communications, and I would say that it's working well.
Not like a broken leg, though, or any other sort of health conditions when the potential for exposure and spreading the disease is there. So occupational health and safety, do they inform staff that have had close contact with an individual that's tested positive? Is that?
Yeah, if required.
There's got to be a contact trace, right?
Yeah, if required, risk assessments are done. Contact tracing is by and large done by the province of Manitoba, but we will work with the province of Manitoba and their occupational health people in contact tracing. But by and large, we kind of talked about this before, I think a couple of weeks ago, but what happens is if you get a COVID test, we follow the same procedures that the province is saying in terms of what you need to do in terms of self-isolate, take care of yourself, and the risk assessments are done, and if there's any notifications that are needed, they're made.
Jeff from CTV.
I just have one last quick one to follow up on what Joyanne was asking. Jay, you mentioned you can ticket because of the frozen waterways bylaw. What's a fine for me being out there skating on a retention pond when I'm not supposed to be?
That's a great question. I don't have the number in front of me, but let me see if I can get that to you.
I can look at the bylaw too. I just thought maybe if you knew at the top of your head.
Where are you planning to go skating on a retention pond this weekend, Jeff? We'll make sure that there's somebody there to meet you.
I have no more questions.
Yeah, I'm just joking. Have a great weekend.
Joyanne from the Free Press.
Just wondering if you have a number on how many retention ponds, rinks, or other uses, like I think you said some people try skating trails there too, that the city has visited and responded to? Like, is this a pretty, the amount of enforcement or education at this point that you're doing?
Yeah, I don't have that number off the top of my head. I know that we did get a sort of a preliminary report from some of the weekends and during the week that we were out there. So let's see if we can get you those numbers. But I know that they were out there in full force visiting. I'm going to say dozens, but I don't have the exact number. And in terms of how many retention ponds there are in the city, I don't have that number off the top of my head, but there's a lot.
Okay. And just a quick one for Mayor Bowman as well. I know you've talked about ensuring there's enough pandemic supports to deal with folks who are homeless and help them out specifically. Do you think we're mostly keeping up with that demand now? Is this still a major issue that we need more supports for in the city?
Well, I guess twofold. I mean, currently the shelters are advising us that there is enough capacity in the shelter system for overnight stays. The province has stepped in with help with isolation units to help ensure those who test positive can be, not in the same area of those who are not. The ongoing concern is that what we don't want to see is what we've seen throughout our community in personal care homes, that the staffing resources are inadequate to deal with an outbreak. And so that remains a concern that we continue to raise, and just to ensure that there is a plan at the provincial level to deal with the human resource reality of when COVID is in a place where residents are vulnerable, and that includes shelter system. So that concern remains. The other concern, of course, is that with ambulance services. Ambulance services are that safety net that the province relies upon. We've seen it with personal care homes. And so, with the issues we've been raising for years at the provincial level and the need for greater certainty and planning around ambulance services, we're one bad night away from a terrible situation where ambulance services are required that can't be fulfilled. And so that concern is significant right now. And it was hopefully, an example of that. Fortunately for us, with Maple's personal care home, we know there was queuing that happened, but that's an ongoing concern, and that concern is there for the shelter system as well.
Malika from Global.
No more questions. I'm good. Thank you.
Thank you. Sean from CBC.
Is it me?
Yep.
Okay, just with respect to the retention ponds, I've got the bylaw in front of me for waterways. It actually doesn't specifically say you can't be on a retention pond or on a designated waterway. What it says is that a designated employee may prohibit. So, it's not... I'm kind of confused about your messaging. You're saying you can't do it. Isn't it the truth that we can tell you not to do it? Or one of our staff can tell you not to do it? Isn't that the flow through on this? Because I don't see anything in the bylaw that says that you can't go skating on a retention pond.
Well, I guess I would beg to differ. The interpretation from our emergency management and our legal folks is that the frozen waterway bylaw basically states that you shouldn't be on them. And the reality is that we know what our engineering and water and waste staff have told us. We know the science behind why they're unsafe, and we're trying to prevent a severe injury. And we're also trying to prevent our resources being used up. We know this is a cascading consequence of outdoor hockey rinks and arenas being shut down. This normally isn't a major issue for us, but it has always been unsafe to be out on retention ponds. And I would ask that Winnipeggers heed that advice, because we just COVID's tough enough. We don't want to have any other types of major emergency or sad story as we move through December. So my message, I think, has been pretty clear that retention ponds aren't safe. And if you can please stay off them, that would be very helpful.
Okay.
I'll just add, Sean, I mean, the city's communicated for years the messaging to stay off. I mean, simply even go to the website and other communications. I'll just echo Jay's comment. They're unsafe, and folks should stay off them. We don't want to have to go out in an emergency situation for a retention pond.
Okay. Thank you.
Joyanne, did you have any final questions?
No, I think I'm okay.
Okay, Sean, were you good as well?
You can hear me?
Yeah.
Okay, sorry. Thanks. Yes, no, I'm fine. I appreciate it, and have a safe weekend, everybody.
Yeah, you
Okay.
too, Sean.
I think
Thank
that's
you.
everybody.
Thanks, Joanne. Thanks, Jeff.
Thank you.
Okay.
Thank you.